It has taken hundreds of lives, mothers, fathers, neighbors, and friends. It has forced our economy to a virtual standstill, shuttering businesses and throwing people out of work. We've all been hit, and hit hard. Today's job numbers weigh heavy on my heart. People have lost their jobs. They don't know if they'll make rent next month. They're worried about making ends meet. We know people are struggling, and today's numbers hit close to home. These are more than just statistics. They represent a small business owner, a store clerk, or a local tourism operator. Real people who are struggling through no fault of their own. In the face of adversity, we must stand together and support each other. We must keep fighting. We must keep going. We must support each other through these difficult times. Believe me, my friends, there's a light at the end of this dark tunnel. We're moving closer to our goal every day. We're flattening the curve. We've been able to move forward because there's an army of 14.5 million people who've all been pulling in the same direction. At the same time, we've been laying the groundwork. We've been helping businesses get ready, adapt to this new environment. We set up a jobs and recovery task force. We fired up our manufacturing engine to make PPE for our frontline workers. We provided over $17 billion in support and relief in the fight against COVID-19. We put in place over 60 workplace safety guidelines, and today we have a solid foundation. We have the right framework for reopening our economy. We have the guidelines to protect workers, and we're going to get Ontario working again as quickly and safely as possible. And that starts today. Today, garden centers and nurseries can fully open, just in time for Mother's Day. And tomorrow, hardware and safety supply stores will open their doors. On Monday, thousands of people will go back to work. Retail stores with a street entrance will begin opening to curbside pickup. That's thousands of people earning a paycheck, working at our mom and pop shops, our small businesses, our department stores, and big box stores. And most important of all, we found a way to get them back to work safely, in a way that protects them and their customers by following the best medical advice available. My friends, there is a long road ahead of us, and there will be some difficult days ahead. We have an uphill battle in front of us, but if we stay united, if we look out for each other, if we give each other a helping hand, we will come out of this stronger and more united, ready to roll up our sleeves and get to work. It will take time and it will take effort, but together we will rebuild what we have lost. Thank you, and God bless the people of Ontario. Now I'll turn it over to Minister Phillips.
Thank you, Premier. Every single one of the 689,000 jobs lost in April represents an individual and a family who is hurting. This virus has taken a terrible toll on people's health and on people's personal financial security. As you know, every step we've taken has been to protect the people of Ontario during this global pandemic. On March 17th, we declared a state of emergency. On March 25th, we announced a $17 billion response package that included $3.3 billion in additional money for healthcare, $3.7 billion in direct support for people and jobs, and $10 billion in cash flow relief for individuals and businesses. Since then, we've announced pandemic pay for our frontline heroes and commercial rent relief for small businesses. We've worked with our federal partners every step of the way, united in our mission to get through COVID-19. None of this has stopped the global pandemic from causing significant pain and heartbreak here in Ontario. Today, as the Premier said, we stand united as a province, shoulder to shoulder with those who've been hurt by this virus. I want them to know that we are going to beat COVID-19. We've already been able to lift some restrictions, as the Premier mentioned. And I've just come from a meeting of the Ontario Jobs and Recovery Committee, which Premier Ford asked me to chair. Our work is based on the framework to reopen our province, which was released last week, and it sets out 3 stages, as well as core public health criteria necessary to move towards reopening. Our next step is to provide more details on each of the stages. I know that people are eager for these details, and we are eager to share them. I believe that we'll be in a position soon to do that. Our goal will be to provide the clarity and heads up employers need to be ready. I'm confident we'll soon be in a position to take another step, a significant step, and that should give us hope. Thank you.
We'll go to the phone line for questions. Just a reminder, 1 question, 1 follow-up. First question.
First question comes from Mark Douglas from 680 News. Please go ahead.
Necessary to move.
Mark. Hi, Mark.
Our next step is to provide more details on each of the stages. I know that people are eager for these details, are eager to share them. I believe that
Sorry, Mark. Mark, we can't hear you. Can you please speak up?
will be to provide the clarity and heads up employers need to be ready.
Take the next question.
Next question comes from Sean Jeffords from the Canadian Press. Please go ahead.
Good afternoon, Premier Ford. I wanted to ask you a question about some statements that QP Ontario has made today. They say that your government wants to water down access that frontline workers have in long-term care homes to N95 masks. They say that these masks are more effective at protecting workers and residents from the spread of COVID-19 than surgical masks. And I'm wondering why the government wants to make this move and begin these discussions. And I'm wondering if you are concerned personally that if this decision is made, that it will further create risk in these homes and contribute to illness and death amongst workers and residents.
Well, Sean, I'm concerned about our frontline healthcare workers and essential service workers 24/7. They're constantly on my mind, but if you don't mind, I'll hand this over to the Minister of Health.
Well, the first and most important thing is to protect our frontline care workers. That absolutely needs to happen for us to be able to flatten the curve. We thank them for going into work each and every single day. We know that they are dealing with some very ill people, and we want them to be properly protected. And if they need N95 masks, they should be wearing N95 masks. That said, we are in consultation with the employee organizations. We had conversations with them yesterday. They certainly understand that there are limits to the number of N95 masks we're able to procure right now because there is a global interest in acquiring them. We have had that conversation. We've also talked to them about the potential for reusing N95 masks if they can be properly disinfected. So there are many issues that come forward. We are having very good discussions with the employee organizations right now. We are forwarding some of their concerns to the Chief Medical Officer of Health for his consideration, but we absolutely want our frontline care workers to have the protection that they need, especially with respect to N95 masks.
Minister Elliott, the union also says today that workers are having trouble, even with this current directive, getting access to these N95 masks. They say they are under lock and key in some of these facilities, and when they ask, they're just not being given them. Is there something the province can do to work with employers, to work with these long-term care homes to ensure that the supply that is out there right now, even if it is limited, is actually getting to personal support workers?
Yes, absolutely. We are doing that. We are working with the employers. As you know, some of the hospitals have gone in to work with long-term care homes to send in their staff because they are short-staffed. They're taking their personal protective equipment in with them as well. I know that there have been some concerns by the employee representatives about people not being able to get access to the PPE that they need to wear. We are having those discussions with the employers because that is absolutely essential. The directive indicates that if the healthcare worker believes that they need an N95 mask for an aerosol generating procedure, they need to have access to it. They need to do that so that they can be safe. So those are conversations that we are absolutely having with the employers at this time.
Next question.
Next question comes from Cynthia Mulligan from City News. Please go ahead.
Hi, Premier. This
Cynthia.
question is for you.
Yes.
It seems quite a furor is brewing over revelations that you went to go up to your cottage, even though it was for an hour. Would you like to address this, and do you think the criticisms against you for doing this are fair?
Sure. First of all, I think any criticism towards me is fair. Everyone has their opinions, and I'll tell you what happened, Cynthia. On Sunday morning of Easter, my team told me I got the morning off, and it was the first time I got off in, I don't know, 2 months. And it's weighing on me because a couple years ago, we had burst pipes, made a terrible mess, thousands of dollars of damage. And that night, you know, I was thinking about it. I woke up early in the morning, 5:30, and then I just got ready and hopped in the pickup truck myself at 6:30 in the morning. I drove up there and checked out, you know, make sure everything was okay, and it was. I literally hopped back in my truck and drove right back. I was back by noon, and that's what happened. I probably won't be going up there for another couple months. We won't have time, but that's what happened.
Follow up.
Okay, thank you. My next question is for my colleague, Faiza Amin, and she's been working on the story of the latest frontline healthcare worker to pass away, Leonard. And Leonard Rodriguez is now the 4th PSW to die from COVID-19. And apparently he was purchasing his own dollar store masks. And Unifor says he didn't have proper PPE to prevent the spread of the virus. And his family says he struggled to get emergency medical support despite his condition worsening and being released from the hospital. What do you say to his family? And also, Premier, there seems to be a disconnect. I know you keep saying that if somebody needs PPE, they will get it within 24 hours, but we still keep hearing story after story of workers not getting it.
Yeah, it's frustrating, first of all, when I hear those stories, but before I even answer this question, I want to give my condolences to the family. My heart goes out to them. My prayers and thoughts are with them, and to all families that lost loved ones through this terrible pandemic, and especially the frontline healthcare workers that put themselves, you know, there for the community. Put the community in front of themselves, I should say. I apologize, and they're sacrificing, and we're so grateful for that. They're saving other lives and putting their own in jeopardy. As for getting the PPE, PPE is available at long-term care, and we've sent out numerous letters, and it's so frustrating hearing that the frontline people are having problems getting the PPE. And, you know, what I recommend, just call. If you got to call my office, call anyone, and we'll have it over there. But it's so frustrating knowing there's PPE there, and the long-term care homes, the stories I'm hearing through the media, that some people aren't getting them. It's unacceptable. Everyone should be getting PPE.
Next question.
Next question comes from Mike Crawley from CBC News. Please go ahead.
Hi, Premier.
Mike.
We're aware of a number of outbreaks of COVID-19 at meat and poultry processing plants, and at one, an employee in Brampton has actually died, and a third of that plant has been shut down. What concerns do you have about whether these meat and poultry processing plants are following the proper physical distancing protocols, and should people be concerned that there's any kind of an impact on the food chain?
Well, we've put 60 protocols in place, and the food and chicken or poultry and meat industry, they're pretty stringent. What I understand, and it's terrible that someone ended up getting COVID at the facility, and we're going to continue with strong protocols to make sure that the safety is the #1 priority for any company, no matter if it's even outside the food chain. #1 priority is making sure that they follow the 60, actually there's more than 60 protocols in place through the health table, through the chief medical officer. It's essential that people follow that, and companies make sure that they keep their employees safe.
And my other question is about the job figures coming out today. If you look back to February before the pandemic, it's basically about a million jobs lost. How many of them do you think are going to come back, or how confident are you that all of those jobs will actually come back, and how long is it going to take before Ontario gets back to the kind of employment rate that we were seeing before the pandemic?
Well, Mike, if there's everyone says, what do you think about at nighttime? I'll tell you what makes me lose sleep. There's three areas: is long-term care, PPE, and those job numbers. When I woke up this morning, they were staggering. There's 689,000 families. Well, as you said, over 1 million that are wondering how they're going to pay the rent. You know, how they put food on the table. We've put over $17 billion into helping people in the system and supports, along with our federal government. I have to thank our federal government once again. They've really stepped up to the plate. They've done an incredible job on all fronts, supporting the people, communicating with the premiers. But you know, we have a strong plan. It's going to be a big fight moving forward. But I have confidence in the 14.5 million people. I'm focused right now on making sure those 3 items, as I say, PPE, long-term care, but the economy is critical. That's my expertise, and I know the expertise of my finance minister behind me, and I'm going to pass it over to the finance minister. But that's our background, creating jobs, and we proved that we could do it before with the help of companies and the people. Without the people of Ontario have been incredible. And we've all been going in the same direction. With their help, I'm confident it might be a little while, but we'll get back to where we were. But now I'll pass it over to the Minister of Finance.
Mike, you're right. Over 2 million jobs across the country, 689,000 here in Ontario. Devastating, unfortunately not surprising, and as you pointed out, over 400,000 last month, so now over 1 million Ontarians. I think I have to say that directly to your questions, with the volatility in the global economy, with the COVID crisis still unfolding, although we are making progress, the specific answers to when we will recover are questions that nobody today can answer unless they have a crystal ball, and if they do, I'd like to borrow it. But I can tell you that the government has been prepared. We adjusted our financial projections, unlike other governments, so that we could be better prepared to provide the $17 billion that the Premier talked about, to also prepare from a government perspective in terms of impacts. And we're going to be there to support Ontarians as we come back. We will come back. This province will come back stronger than ever. But right now, we are in the middle of a global health crisis and the middle of a global economic crisis that is worse than has been the case in my lifetime. So we're all going to have to work together, and we're going to come through it together. But for now, we need to keep looking ahead at the actions we can all take to get the health crisis under control, listening to our public health officials, and as I talked about earlier, in a safe and gradual way, with direct consultations with business, work to open up the economy so that we can see some of those jobs return.
Next question.
Next question comes from Rick Westhead from Sports Network. Please go ahead.
Hi, Premier Ford. Thank you for taking the question.
Thank you, Rick.
Given that Ontario is having a difficult time reaching the stated goal of 16,000 tests for COVID per day, what concerns do you have if Toronto is approved by the National Hockey League as a hub city? How can you assure the public that the thousands of additional COVID tests required by those connected to hockey would not negatively impact the public's ability to obtain testing?
Well, right now, I think yesterday's numbers were 15,000. We do plan on making sure we hit our 16,000 target, and then once we hit that, our other target's going to be 20,000. And there's always a couple bumps in the road. You see a little, a little spike and then downwards and back up. But I want to thank our health team out there, our public health team and health table for doing a great job. To answer your question about the Toronto Maple Leafs or even the Raptors, we have had conversations with them, and it's all based conditional on following the Chief Medical Officer's protocol. People that aren't in the country right now, if they do come back, they're going to have to be quarantined like everyone else for 2 weeks. I understand with the Raptors, the NBA and the NHL have super stringent restrictions and protocols in place. I'll give you an example. The NBA is saying only 4 people can be on the practice court at a time. I understand the Raptors are going to let 1 person on the court at a time. So they want to make sure, and I know the players, they want to protect themselves. And I think everyone, they're going to be playing in an empty stadium when that comes, and I don't even know when they plan on starting the season, but they're going to be playing in empty stadiums. And Rick, I think everyone wants to see a little bit of sports if they're doing it responsibly. I love watching any sports, be it the NHL or Raptors or the Blue Jays, but those rules will apply for all those teams. There isn't going to be an exception.
Do you have any sense for how many tests would be required if you have a National Hockey League city here like Toronto as a hub, and you have 6 teams coming in with hundreds of players, coaches, and support staff, and they need to be tested presumably several times a week at the very least?
Yep.
Do you have any sense yet for how many tests would be required to make this happen?
Well, what I understand, all tests will be supplied by MLSE. The cost will be absorbed by MLSE or the NHL, whoever it might be. And I guess through that, when they set it up, then they'll actually donate some of the time of the testing area to the public as well. So they're giving back to the public on top of testing their own players, which I thought was very thoughtful of them for doing that.
Next question.
Next question comes from Emily Pelletier from Le Droit. Please go ahead.
Hi, Emily.
Hi. Hello, Premier. In Ottawa, there are far less cases of COVID-19 than there are in some areas in Quebec, such as the Laurentides and Montreal. The province of Quebec has removed the police presence on the bridges between our provinces, except for Gatineau. Are you worried about a spike in Ontario cases now that people from Montreal, for example, can come to Ontario as they wish?
Well, we had the Premier's meeting yesterday on the phone. Conversation came up about the U.S. border and other borders, and we've all agreed within the province, don't cross the border. We love our Quebec neighbors, but just wait until this is all over. It's to their benefit, our benefit, and the country's benefit. And as the question came up with the U.S. border, and I was adamant on the call yesterday with the premiers and with the Prime Minister, I do not want those borders opened. And I know Quebec felt the same way, and BC felt the exact same way, and I can't speak for the other provinces. But right now, I don't want the borders open. And when the time comes, I did mention this on the call, we need to pick up the screening tenfold at our airports and our border crossing. And it's not the Canadian border officers that have to do this. We should be able to bring other people in for the screening, because the Canadian border officers that we have are they're all-stars. They're doing an incredible job keeping our country safe every single day. So I just want to give a shout out to all the border agents. You guys are absolute champions, and appreciate the job you're doing.
But specifically between Ontario and Quebec, there's a lot of people living in Ottawa that have family members in Gatineau and vice versa. So when the Ontario economy will be reopened and people will be able to visit their families on the other side, what will happen for these people if the bridges are still closed? Will you have another conversation with the Premier of Quebec about it?
I'll have another conversation with Premier Legault. As I've always said, you know, we have a phenomenal relationship, both of us. Matter of fact, all the premiers have an incredible relationship, and we'll have that discussion. But he feels the same way I do. Let's just stay within our own province, and until this gets over with, and then we can visit family members and that. But the best bet is just to stay within your own boundaries.
Next question.
Next question comes from Rob Ferguson from the Toronto Star. Please go ahead.
Hi, Rob.
Hi, Premier. I've got one. You can field it if you like, or else the Health Minister too. I'm wondering, since we have very persistent numbers of new cases in the Fort, generally around 400, or today up almost to 500.
Yeah.
This is persistent. Why are we not putting people who test positive in the empty hotel rooms to further shut down the chain of transmission, particularly within households, where it often seems that if someone gets it, at least one or two other occupants of the house get it?
Yeah, I'll pass this over to the Minister. Thanks, Rob.
Well, you're right, Rob. We are seeing a sort of a shifting of numbers. We had several days where we were under 400 cases. Today, it increased to 477. But that is more or less to be expected as we see a gradual reduction in cases. We've spoken with the Chief Medical Officer of Health about it. He is very optimistic about where we are headed in Ontario. It's not going to be a big step down on a daily basis. It's a very, very gradual reduction in the number of cases. So we are taking every step that we can in order to deal, first of all, with long-term care, because we know that there are many cases coming from there. That's where we're concentrating a lot of our testing right now. And so it's very sad, but not unexpected that we would see these increases from time to time on a daily basis. But overall, the picture is looking much better for Ontario, which is why we're able to be loosening some of the restraints on the economy. We're going to be following that closely, though, and if we see big increases in the numbers over the next 2 weeks, we're going to have to rethink it. But as things are now, things are gradually reducing. The number of cases on a daily basis is reducing, and we are following that closely to ensure that continues.
Okay, thank you. And are you getting any better sense of how many cases a day are community transmission versus long-term care or retirement homes or other forms of congregate living? This all seems to be very fuzzy, and I'm wondering why it can't be pinpointed a little better.
Well, we are receiving tests in from all different parts of the province. We have 20 different organizations that are doing the testing. So that's one of the reasons why you see the numbers being a little bit different from day to day. But I would say that we are still seeing the majority of the cases in long-term care and retirement homes, but there is still some community spread. So that's why we need to continue to do the testing in the community. We're going to increase that. We need to get it up over 20,000. We are working steadily towards that, but we need to continue to do that because as we're opening the economy, we need to watch and see if there's any one thing that's causing more community spread, and then we need to deal with that. But the community testing is going to continue to be very important for the next short while.
Last question.
Last question comes from Haley Cooper from News Talk 1010. Please go ahead.
Good afternoon, Premier.
Hi, Haley.
Regarding the Raptors practice facility being reopened to the team, one player, one coach only allowed in the facility at once, we started to wonder, what about recreational activities for the public where they can properly physical distance, like golf and tennis? When will those be reopened to the public?
Well, Haley, I have a lot of friends that are golfers, and they're lobbying hard for this golf. Boy, I'm to be honest, I'm a terrible golfer, but in saying that, we have to just listen to the Chief Medical Officer, and they're giving me every single reason why they should be able to go out there, physically distance. They won't take carts there. I'm going to give you all the reasons. I'm getting lobbied. They told me they won't take carts, they'll walk. They have this new little mechanism that you don't have to touch the flag when you hit the hole. the ball will pop out and they'll be apart from each other. That's their that's their lobbying points, and I bring it back to our chief medical officer. I don't know if he's a golfer. I never asked Dr. Williams, but eventually they'll be able to get back on the golf course based on the safety and the protocol. And I understand if they don't take the carts and they separate, they have a pretty good case there. But I'll bring back that to the team. And again, safety is number one concern. And again, for the tennis, two separate people, different sides of the net. I'll go to the table for those two issues. I understand people want to get out there and get a little bit of fresh air and a little bit of exercise, and God knows I need a little bit of exercise myself.
And my follow-up question is for the Finance Minister.
Yes.
Go ahead.
Thank you. On April 4th, Mayor John Tory called for a freeze of evictions for commercial tenants. On Tuesday, May 6th, so this past Tuesday, a letter was sent to you from the Economic Developers Council of Ontario, the Ontario Business Improvement Area Association, the Tourism Industry Association of Ontario, and there's also a growing petition online calling for a freeze of evictions. I spoke with a business owner just yesterday who says their landlord has already told them they will not participate in the rent relief program. They're being threatened actually to be taken to court if they don't pay tens of thousands of dollars in rent. So I'm going to ask again, is the province considering freezing these evictions for commercial tenants? And if not, why?
So I appreciate the question, and in fact, I just this morning was talking with not only Mayor Tory but the rest of the large urban mayors, and it won't surprise you that they asked about this as well. We are looking forward to the program opening up. That will happen next week, according to the federal government, led by the Canada Mortgage and Housing Corporation. As I said before, there's been important improvements to this program. Obviously, the province maintains all the options that it has, including what you talked about, if that's necessary. But I think what is important is that the program get a chance to get a chance. It needs to be initiated. We need to make sure that everybody understands very clearly what the program offers, and you'll give me the chance to repeat that, which is that landlords would receive 75% of the rent, tenants would pay 25%, and the federal and provincial government would make up the other 50% of the gross rent. Also, those with mortgages or without mortgages would be eligible. So these are the kinds of feedback that we have gotten. The program will open next week. We're hopeful, and we certainly have had many, many landlords who have shown an interest. But as with everything we do, we'll have to see how that works. And of course, the province always maintains all of the options on the table. We do want to make sure that we protect commercial tenants. We want to make sure we protect commercial landlords. We want all these businesses to be able to come back as strongly and as quickly as possible.
Thank you very much.
Thank you, everyone.